I come into the patient's room with all my equipment, and I do hand hygiene and put gloves on. And I'm going to explain to the patient that they're getting saline because they're dehydrated, and ask them to identify themselves, name and date of birth. And let me check that. And I'm also going to check for allergies. And I'm going to use my cow to scan their bracelet, and I'm going to scan my saline. I'm going to provide privacy. So that was my third check, and CHIPA and my sixth right, so med, route, dose, time, patient, and documentation. So now I've done all that, I can get them into position and get ready to do the IV. So before I do the IV, I want to do all the checks. So I'm going to check for edema, I'm going to auscultate, ask if they're thirsty, check their level of orientation, get a set of vitals, make sure their weight hasn't fluctuated too dramatically and that there's a current one taken, initiate INOs, and other general dehydration items like cap refill and turgor. And since I've touched them, I'm going to take these gloves off and do hand hygiene and get ready to do my IV. So, over here, I've pulled my IV pole around, and I'll lay out all my stuff. So, I'm going to open up my needle, get my saline, and take my attachment out of its box if I had one, and go ahead and connect the saline to it and flush it. So that's good. Then I have that ready, and I keep the cap on it so that it doesn't get dirty. And I'm going to open my IV kit. Okay, so I'm going to lay a pad underneath my patient's arm to soak up any water, and I'm going to kind of look around and see which vein I want to do. I think I want to do this one. I'm going to go ahead and label my tegaderm, and get my tourniquet prepared. Put some tape out for securing it. Not that first piece. Got some tape out. All right, and I'm going to clean the area before I tourniquet. Squeeze that and give it a clean in a circular motion outward from where I'll be doing it, and let that dry without waving your hands over it. You're not supposed to do that. And apply my tourniquet. I'll tell them it will pinch a little bit. Don't want to lie to them. And I think I've got everything ready. I'll just run tourniquet. And I'm ready to do my IV. So make sure the bevel is up. I'm going to pull the skin a little taut and insert. I get flashback, so I immediately release the tourniquet and slide the catheter forward. And remove my needle, and that goes immediately in the sharps. I'll reuse that later. So I'll go immediately in the sharps. I'm going to secure this with a little piece of clear tape. So I have that secured with a little bit of tape, so now I'll flush it, make sure that it's in where it's supposed to be. I'll attach where I flush this with the saline and do a little bit of a push to check. Nothing's blebbing or swelling up by it, so that's good. So now I'm going to put my big Tegaderm over it to secure it. Make sure the whole thing's covered but visible. Take that off. Make sure I get my label off of that. So that's all secured. Put my label on. And fill out my line, my new saline line. I'm going to fill all that out with the date and time and initial, and I'm going to put that on my tubing so they know when to change it. Now that I have that all set up, I can program this and connect it to their new IV. So turn it on. Take this over here, take this little piece of paper off. Run this over here. I got myself a little alcohol swab since I prepped this outside of the room, you never know. And it is clamped. I'm gonna clean that. Pop it off of the saline. Clean that. Attach them. No air in the line. It's going to be a new patient on med-surg. Okay. And it's going to be IV fluids, guardrails, and it's 9% saline. 9.9% saline, yes. I want to do my rate. For this patient, we'll do 120. And the mils on this saline is 250, so I'll put it at 240. And start it. Make sure all my clamps are done. And it's checking. And it says I've got something included. Patient side. So I'll check it. And it might just be coiled too tight. Okay. Restart it. And it checks. And it's good. And then I would take my gloves off, do hand hygiene, tell the patient to be careful getting up and call if they need help because this is plugged in and that you don't want them to pull it out. Let us know if there is any discomfort around it or if there's anything leaking from it. I'll document where I inserted the IV, that I performed patient education, that INOs have started, and I'll check back every couple hours to see how they're taking to it and to check on the whole setup. And